Hello, everyone. My name is Jack Unga,
I'm Emma Anderman.
I'm pre-bet.
I'm Vima.
And I'm Sophia Kim.
and the dental material we chose as a group is Omnichroma, a resin-based dental restorative material. Omnichroma is a universal radiopaque, one-shade resin-based composite. It incorporates smart chromatic technology, a unique technology based on fillers that generate red to yellow structural color. As a result, the cured composite blends in with the surrounding tooth structure of almost any patient. Prior to light curing, this paste is opaque white and transforms upon curing to blend in with the surrounding tooth structure. The major uses for this material include every class of restoration: direct anterior-posterior restorations, direct bonded composite veneers, diastema closure, and repair of previously done composite restorations. These applications are backed by the product's mechanical properties such as its compressive and flexural strength, its stain resistance, and its hardness and wearability. These pictures above are examples of restorations using this composite. These exemplify its shade matching capabilities, and these exemplify its shade matching capabilities. The compressive strength of about 400 megapascals and the flexural strength of 111 megapascals are at levels higher than the average among commercially available resin composites. In terms of hardness and wearability, Omnichroma is hard enough to withstand the forces of mastication while still retaining polishability. In a test of 50,000 cycles, Omnichroma exhibited an excellent balance of not being worn down while also not wearing down the opposing enamel. In polishability tests, the product was seen to have high levels of glossiness. In stain resistance, the composite resin had relatively low extent of staining and so will resist staining for the life of the restoration. One important feature of this product is that it is a one-shade universal composite and can be color matched to all teeth shades in order to streamline the restorative process. This is made possible by the uniform spherical filler used and leveraging structural color as opposed to dyes and pigments for coloration.
All smiles have something in common, and that is the colors that make up the human teeth. From A1 to D4, all teeth express a narrow range of red to yellow colors, and to match every smile, most commercially composite brands require multiple shades because most of them depend on the colors of reds and yellow dye added to the resin material to emulate the tooth shades. This means that dentists must keep a large inventory of different composites to accommodate a variety of patients. But with the new developing technology of Omnichroma, this will no longer be a problem. Omnichroma fillers generate red to yellow structure colors as ambient light passes through the composites without the need of added pigment and dye. The red to yellow colors combine with the reflected colors of the patient dentitions, creating a perfect match from A1 to D4s and beyond. Thus, clinical-wise, this ability helps eliminate the shade-taking procedures, reducing composite inventories, and of course, saving the dentist times and money. In addition, its uniform size supranano spherical fillers allow Omnichroma to have an impressive compressive and flexural strength with an excellent balance between the volume loss of the composites, resins, and the wear of the human tooth. Omnichroma are also known for its stain-resistant abilities. With consistent test trial, Omnichroma show little to no staining after 24 hours, coffee's immersing test at 80 degrees Celsius. Thus, with Omnichroma, patients can confidently enjoy any foods and beverages they want without the worries. The combine of unprecedented shades matching abilities with the exceptional handling, polishing abilities, and strength, Omnichroma is truly the next generations of universal composites.
So Omnichroma works by manipulating light and reflecting that shade that it has been bonded to. If the composite isn't bonded to a surface, the fillers can't reflect the shade match back to our eyes. Omnichroma Blocker is a supplementary product to Omnichroma. You don't have to use it for the product to work, but it's helpful in restorations that lack surrounding tooth structure and or dentin, like in class 3 and class 4 restorations. The blocker can also be used to mask staining like pre-existing amalgam stains or to reconstruct a highly opaque tooth. When using Omnichroma, you should add a bevel in your prep to eliminate margin visibility and ensure shade matching. For both anterior and posterior teeth, you want to etch, apply a bonding agent, and then add 1 millimeter of blocker for posterior teeth and 0.5 millimeters of blocker for anterior teeth. After light curing the blocker, you should apply Omnichroma in 2 millimeter increments, light cure, and finally finish and polish. Omnichroma has excellent shade matching, like we've mentioned. So if the patient's teeth darken over time, or if they want to whiten their teeth, this product will adapt and shade match to the teeth, so you don't have to replace the composite. The shelf life is about 3 years from the date of manufacture. It's recommended to store this product in a cool, dark space at or below room temperature. It works like other composites that we've used, just simplified. If the cavity is deeper than 2 millimeters, you should work in layers before curing. The product comes with a self-etch, self-cure bonding agent. That's 2 components. But you can use any bonding system that's used with typical resin composites. It's compatible with total and self-etch. It's compatible with dual and self-cured materials without the use of an activator, and it can be used as a primer for silica-based and metallic restorations.
Our group chose Omnichroma to compare it to Filtek Supreme Ultra Universal Restorative Material. Filtek is a university used material used for both posterior and anterior restorations. Its particles range from about 4 to 29 nanometers in size, which are present in clusters. Its cure time ranges from about 10 to 20 seconds, depending on if you're working with enamel or dentin shades. Omnichroma is a universal composite with a supranano spherical fillers that function anterior and posterior restorations, as well as diastema closure, composite veneers, and repair of porcelain. Omnichroma particles are 260 nanometers in size and have a cure time of about 5 seconds. In clinical evaluations, Filtek ranked slightly better for compressive and flexural strength, both still reporting above average. Omnichroma ranked better for a balance between the volume loss of the composite resin and the wear of the tooth, as well as overall aesthetics. They were the same for their ability to resist stains. Overall, Omnichroma was more cost and time effective because of the elimination of the process of picking out a specific shade. Omnichroma costs about $107 for 20 of the 0.2 gram tips, whereas Filtek costs $150 for the same amount. Omnichroma also eliminates the need to redo a restoration due to a patient whitening their teeth because it will match the shade before and after bleaching. Ease of use of the product was above average for both, but Omnichroma had a slightly better range of reviews on polishing and glossing ability.
So with over 35 years of research and development, in 2019, Omnichroma first came out with the universal composite. And then 2 years later, they came out with a flowable composite. So our most important question of our presentation is, do we recommend using Omnichroma in general dentistry practice? With all the data we presented, our group highly recommend Omnichroma in general dentistry practice. As Omnichroma is a universal composite matching the shade A1 to D4, it eliminates the need to buy a different shade of composite when doing restoration. This can help eliminate the needs for color matching and wasting of expired composite. Omnichroma also eliminates the need to select a shade when doing composite restoration. This removes human errors and lighting errors during restoration to closely match adjacent teeth. Although Omnichroma is 3 times more expensive than regular composite, the excellent color matching and minimal wear factor will provide a satisfactory result for the patients. Here is a list of our reference, and thank you for listening to our presentation.